Myths about GERD, its causes, and how to fix it abound. We've covered some of these in a prior video, and there's so many of them that we're going to cover more of them now. Theory 1, the stomach is producing too much acid. This would seem like such a logical theory because we use acid-suppressing medications to help control GERD, but this is in fact a myth. Most of the damage being done to the esophagus is not because the stomach is producing too much acid, it's that the lower esophageal sphincter is allowing too much stomach contents to be refluxed back up into the esophagus. Other people have problems because their esophagus is unable to move reflux back down into the stomach. So the problem is not that the stomach is producing too much acid, but rather that too much reflux is being permitted up into the esophagus, or the esophagus is failing to clear that reflux back down into the stomach. Theory 2, acid is the only problem. This would again seem so logical because so much of our treatments focus on acid reduction, but is again in fact a myth. Not only does the stomach produce acid, it also produces an enzyme called pepsin. And whereas the healthy esophagus can withstand a huge amount of acid before enduring an injury, pepsin starts to break down that healthy esophagus barrier, making it more susceptible to injury. The liver produces bile acids, and those normally reside in the small bowel, but they can reflux back into the stomach and follow their way up into the esophagus, again irritating the esophagus. A person who's had a stomach surgery, like bypass surgery, is more susceptible to large amounts of that reflux. So it's not just a problem of acid, it's also a problem of these stomach enzymes and bile acid. Ultimate injury of GERD is actually perpetuated by an immune response to those initial insults. And so GERD is ultimately also an immune inflammatory reaction. Theory 3, you need an annual endoscopy to monitor your GERD. This is a myth. Some patients receive frequent endoscopy to monitor their GERD symptoms despite there having never been an endoscopy that showed any high-risk findings, nor have they really had any substantial changes in their symptoms. This is not necessary, so here's what I advise. If you've had an endoscopy for GERD and your esophagus overall looked pretty healthy, then you don't need a further endoscopy unless you have a substantial change to your symptoms. If you have a really irritated esophagus, then let's take a second look in a couple of months after medical therapy has a chance for your esophagus to heal. We then want to go back and take a second look to see that it's healed successfully and there's no concerning changes such as Barrett's esophagus, which can be a precursor to cancer. If we find those kind of concerning findings, then we can talk about a long-term follow-up plan. But if you have none of these concerning findings and your symptoms are stable, then you don't need to have frequent repeat endoscopies. Theory 4, tight clothing worsens GERD. This is a fact. Tight clothing, especially that designed to contour the stomach, is going to increase abdominal pressure, which means something's going to have to come out somewhere. So if it ain't coming out the bottom end, it could be refluxing up the top end. What occurs is that as abdominal pressure increases, it stresses the lower esophageal sphincter, and it's going to produce more reflux events. Theory 5, the lower esophageal sphincter is weak. This is a myth. The lower esophageal sphincter holds the door to the stomach shut to minimize reflux. It permits food to enter into the stomach, and it opens to vent burps. Now, the lower esophageal sphincter may not be as strong as Hodor from Game of Thrones, but it's not weak. Studies have shown that only a minority of individuals with GERD have a weak lower esophageal sphincter. But that's not to say that people may have conditions that cause their lower esophageal sphincter to be weaker. A person's lower esophageal sphincter may be weakened by certain behaviors like smoking, eating too much and the stomach distending, or certain foods and medications. Many patients with GERD do have a lower esophageal sphincter that relaxes more frequently and longer than healthy patients. This allows more reflux contents up into the esophagus, so their lower esophageal sphincter is flaky, but not weak. I hope breaking down these myths helps you better understand why GERD occurs and some of the reasons that we give lifestyle advice to help control it. If you found this video interesting, please subscribe to the channel and look forward to more content on how to help control your GERD.